Medical facilities are to be provided at 50 nursing homes in Shanghai this year, and the medical service that the elderly people receive is likely to be covered by the city's medical insurance. One nursing home in downtown Jing'an is the district's first to apply for a license in medical service this year. But as our reporter Chen Bing finds out, things are more complicated than what most people think.
83-year-old Chen Yeming receives a routine check by a visiting doctor from a nearby community hospital this afternoon. She suffers from high blood pressure, and the treatment is long and expensive. Although doctors visit Chen's nursing home on a regular basis, Chen still has higher hopes.
If the doctors are immediately available and the treatment could be covered by medical insurance, it will be better.
More than 70% of people over 60 years old have chronic disease, such as high blood pressure, diabetes, and heart diseases. Although we would check every nursing home in the area once a week, that's not enough for them. So the nursing home plans to set up its own medical team, along with a treatment room and pharmacy.
Our medical service center is going to recruit 5 doctors and 6 nurses, which basically meets the requirements of the city's health authority.
Yu submitted the relevant documents to the city's health authority yesterday, but after getting the medical license, Yu will still need to ask for insurance aid from the city's Social Security Bureau. By the end of last year, nearly 140 of the city's 660 nursing homes had set up a medical service, but only 88 of them were covered by medical insurance. Although there has been calls from legislators at the just-ended annual session, one medical expert says the city's medical insurance is limited and financial aid should be given to those who need the help most.
The combination of a nursing home and a medical facility aims to offer reasonable care to the elderly who suffer chronic diseases. In order to allocate limited government resources properly, we manage to classify the health level of the senior citizens.
So Lai's Geriatric Hospital, the first of its kind in the city, is working on a system that could assess the health condition of elderly people in a comprehensive way.
The test will not only be helpful to the old's rehabilitation, but also give instructions to those who are going to take care of the old. For example, it will tell if the right part of the old or the left part is weaker.
Lai suggests that the elderly people with the same level of health could live in the same nursing home. That will be good for patients suffering from long-term disease such as Chen Yeming. But experts including Lai point out that the city has a more urgent task for its aging population. Officials say people aged over 60 accounted for nearly 30% of the city's total population last year and is expected to rise by 5% this year. But the city only has 120,000 beds at nursing homes for the elderly. Chen Bing, Shanghai Live.